Roger, thanks for coming in today to share your experience of your cancer diagnosis. In your case, I think it's an esophageal cancer.
Yes.
And there's not many people who've been in to see us with an esophageal cancer, so I appreciate you spending this time with us today.
Okay.
Can I ask you about how the diagnosis came about in the first place?
In the spring, early summer of 2005, I was overweight, and I consciously wanted to lose weight. But I got to the stage where I felt that I was losing the weight, but it was getting out of my control. The weight loss was controlling me rather than the other way around. At the same time, I was travelling abroad quite a lot with my work and eating out socially, and I was finding it very difficult to swallow food. And it was getting embarrassing, to be honest. I would sit having a meal, and quite intermittently I would have to put my cutlery down and wait for food to pass through before I could start eating again. So I realised that I had a problem, but I felt that I got a slight blockage somewhere just under my chin here. And but I realised that it wasn't something that was normal, so I went to see my GP.
What did your GP say, and what did they do? Did they arrange for certain tests?
They did. My GP was very positive. That was one of the aspects that really pleased me about it all. I had a very sympathetic GP who I think he realised straight away that I'd got quite a major problem, and he arranged for me to see a consultant. And I went along and had tests, yes.
Now, were you anticipating anything at that stage?
I wasn't quite sure. I realised that it was probably something that wasn't normal, and it wasn't something that was probably going to be easy to cure. So yes, the warning bells are ringing a little bit, I think. Yes.
Now, I'm assuming then you had further tests in the hospital. What was the test that kind of clinched the diagnosis?
I had an endoscopy. And I was told after the endoscopy that I had got a blockage in my esophagus, just at the entrance to my stomach.
And that's what was giving you those symptoms at that stage?
Yes.
And did they give you the diagnosis or just the description? Because that's the description, isn't it?
After the endoscopy, I was given the description, and then I sat down with my consultant and he gave me the bad news. Yes.
How do you think that was handled? Because that's always a controversial area, isn't it?
Well, I was 57 at the time, which I thought was quite young. And as I've said before, I'd had a relatively hospital-free life until then. So it came as a bit of a shock. But the explanation of what the problem was and the scenarios involved with it were explained to me very, very well. In fact, Mr. Ubi, who did my surgery, he got a big sheet of A3 paper out and drew it for me and told me exactly what was the problem, showed it me, and he gave me the different things that could happen. And although it was a major shock to me, of course, I was encouraged by that. I thought it was excellent, yeah.
If you're told bad news, but then the clinician does their best to say they can help you and point you in the right direction and actually appear like they're on your side, it can really minimise that adverse anxiety and effect on you.
Yes.
And it sounds like you had that faith and trust in the clinician at that stage.
Yes, definitely.